non-union shaft of distal end of humerus. Okay, don't tell it is femurous and all. It is humerus. Okay, there you can see the fracture at the distal end of humerus, and you can see it's non-union. How do you say non-union? The edges become rounded up. Okay, the edges have become smooth. Vasul Rajala. Photo. I'll only tell sir, please tell all these people. So this is non-union distal end of humerus. How do you say non-union? Because the margins are not irregular. If it's a fresh fracture, the margin should be irregular. The edges have become rounded up. You can easily see the rounded edge. So this is non-union distal humerus.
Next sir, another sir.
So this is old fracture, both bone, forearm. First you always should read the X-ray. So it's in a plain X-ray showing forearm with the elbow and wrist joint. Okay, you should read entire, whatever the bones you are seeing, you have to read it out. Okay, or you have to collect it in a group and tell. So it's X-ray, both bone, forearm with the elbow joint and the wrist joint. Okay.
Sir, last you to name the bones. What is, which is the radius, which is ulnar caper.
Okay.
Identifying features. The radius is the ulnar caper.
So this one is radius, radial head, shaft, distal radius. This is ulna. Okay, this is head of ulna. Head of radius is in the elbow. Head of ulna is in the wrist. Okay. This is olecranon, shaft of ulna. So this is the old fractured point. Okay. It's a fresh fracture or old? How do you say it's a old fracture?
Edges round.
Again, edges are rounded up. Okay.
Automatically.
You are ready for it. So this is X-ray, bilateral knee, AP view. You are seeing both the side knee. Okay. Bilateral knee, AP view. The fibular side is always the lateral side. Okay. It can even be kept like this. It is why we tell it is right side or left side. Suppose if you have only one side X-ray, you will see on the position of fibula. Okay, so fibula is always in the lateral side. So what you can see here, you can see what you can see? Joint space narrowing is there. Okay, so this is a joint space narrowing. These are marginal osteophytes, classically seen in osteoarthritis knee. Okay, so subchondral sclerosis is there. Okay, joint space narrowing is there. Marginal osteophyte is there, and mild amount of deformity also will be there. Some X-rays you can see like this varus deformity. Osteoarthritis, what you have in the X-ray is a varus deformity. Okay.
The external deformity.
Valgus. Okay.
This is valgus. Okay. This is the lateral compartment osteophyte.
Usually medial joint space only will be narrowed, but here the lateral is more. Okay.
Why do you say valgus?
The angle between contacts of femur tibial spinal
Yes.
fuse.
Which bone is this? Remember, so it is a old fracture, shaft of distal end of humerus. Say distal end of humerus. Okay.
Why do you say it's humerus? Head of humerus. That side, okay.
In this X-ray, how do you say it's humerus? This is supposed to be AP and lateral view. So in this AP view, how do you say it is humerus? How do you say it's humerus, man? Associated, what is there? What else you can see? Huh?
Capital.
It's just proximal, which is distal part of humerus in this X-ray.
Distal says that is distal, this is proximal.
Which is proximal?
This is
Below saying
below
it-
is proximal, last.
This is proximal, huh?
No, in that
In this
one.
X-ray.
In this
Ah.
one, that is distal. and
This is proximal, that is distal.
That is reverse.
How do you see image? You can see the head of radius and the ulna, okay? So this is elbow joint. What else is seeing there? Comment on the fracture.
Displaced
Is it united? Displaced, agreed,
Displaced.
agreed.
and
Is it united?
but
No,
callus
no.
formation.
That is the hypotrophic non-union. Don't need to hypotrophic non-union as a postgraduate level. So you can say it is a non-union shaft distal end of humerus. But sir will ask, why, how do you say it's non-union? Then he'll ask, what is this?
Callus.
You have to say callus. Then he'll ask, if callus is there, how will you say it's non-union? So you have to say that's a exuberant callus formed outside the bone, but still there is no continuity with the fractured fragments. Okay, that's called gap non-union. Or actually it is hypotrophic non-union. Okay, this could be either from the native treatment or a myositis mass or a callus. Okay, any doubt you stop and ask, man. Don't chumma come for my sake and sit here. What is this? Again, both bone forearm, AP and lateral view. It's a yield united fracture of radius and ulna. Okay, here you can see there is no fracture lines seen. Bone has become broadened. Here you can see the bone is broadened. Okay, and with the plate and screws in situ. Okay, with plate and screw in situ. Here same X-ray of forearm where the fracture line still persists with plate and screw in situ, and here you can see a gap non-union. Okay, it is not united. Sometimes he may ask, what are these fragments? You can say it's a bone fragments. What bone fragments he can ask? Actually it is a grafted area. So they taken iliac crest graft and they kept along the sides. Okay, for enhancing union. It's a non-union shaft of radius with the plate and screw in situ. So it's post-operative non-union. Okay. What is this? Fracture. X-ray showing forearm and wrist joint. Is the fracture of the lower one-third ulna. This is lower one-third ulna. Okay. Fracture of the lower one-third ulna. This will be your exam X-ray, I guess so. Always, anytime. Last year only this X-ray was kept for the entire 150 or 100. Only one X-ray for everyone, which was this. This is the basic Colles fracture X-ray. Okay. So it is a fracture of the distal end of radius. That's called Colles fracture. Colles fracture means always elderly patients, not for pediatric age group. Okay. Extra-articular, the main word is extra-articular distal end of radius. Intra-articular goes with Barton's fracture. Along with radiocarpal subluxation, it goes with Barton's fracture. Extra-articular occurring at the cortico-cancellous junction, this area. This is cancellous area, this is cortical area. Any bone close to joint is cancellous, spongy bone. This area is spongy. This is close to the wrist joint, so this area is cancellous. This is cortical bone. So fracture occurring at the cortico-cancellous junction is called Colles fracture in elderly patient. Extra-articular fracture, extra-articular. Okay, and you have to study about the displacements of Colles. Dorsal tilt, dorsal displacement, lateral tilt, lateral displacement, supination. You have to tell. Impaction. Again, what is the difference in this and that? What is this? What is that? No. So you should always comment on the lateral view. Okay, lateral view X-ray will tell whether what displacement is that. See, this is a dorsal displacement. So this is a dorsal view. I am keeping the lateral view. This side is the palm. Okay, the palm is facing this side. Able to see? So these are the metacarpals. So this is the dorsal volar or palm side. So you can see the distal fragment is displaced upwards. So that is dorsal displacement. Here you can see this is just impacted fragment. Okay, fracture distal end of radius. This is articular area. So it is extra-articular Colles fracture with impaction. Okay, so now you can see this is dorsal. This is volar, palmar. Dorsal or volar or palmar. What tilt is now? tilt is always seen on the distal fragment. A fracture is always read from the distal end. So how is the distal end here? This is the distal fragment. This is the proximal, this is the distal. How is the distal fragment pointing? Dorsal displacement, okay. It is tilted dorsally only. Purida? What is this? X-ray showing tibia, fibula along with ankle joint, APN lateral view. What else you can see? Bony irregularities noted. Okay, you can see the bony irregularities. Okay, suggestive of infection. What infection? Osteomyelitis. How do you say osteomyelitis? You can say there is new bone, multiple patchy areas of new bone formation. These are multiple cloacal opening. Cloaca is a place where the bone is open. Inside will be a sequestrum. Okay. In lateral view, this is the cloaca. In AP view, these are the multiple cloaca and irregular bone borders. And irregular bone border is called broadening or thickening of the bone. Common for osteomyelitis. Okay. Osteomyelitis is always identified with the broadened bone. Or you have to say irregular thickened bone. Okay. Don't use the word broaden. You say irregular thickened bone. Broaden again postgraduate. So any doubts in X-ray? Only these X-rays will be there. It's finalized. Any doubts in X-rays?